Thank you, Mr. Chairman, and Ranking Member Bishop, and thank you, Dr. Califf, for coming before our committee today. I appreciate you making your staff available to mine as we've worked not only to address some of our questions about the baby formula shortage, but many of our other shared priorities as well. I want to actually follow up on something Ranking Member Bishop kind of brought up in looking at the pilot program dealing with India specifically, but I'd like to focus on the challenges we face when it comes to our supply chain with manufacturing in China. Part of the FDA's role is to conduct inspections on these drug manufacturing facilities to ensure that there is compliance and also, of course, for safety reasons. But unlike domestic inspections, which are announced, foreign inspections are unannounced, especially when it comes to China. China may be even getting several weeks of notice before these inspections are happening. So in previous years, this committee has, of course, directed FDA to have that pilot program on unannounced foreign inspections in India and China. You've been working toward the conclusion of phase 1 of that pilot program. So I guess I just kind of like an update on that and where you stand on that pilot program.
Sure. Again, I've been an inspectee, and I really believe in the value of both kinds of inspections, and I also want to emphasize that the regulatory authority to look at records online throughout the course of the year is a very important part of a surveillance system, whether it's in the U.S. or anywhere else in the world, because the internet is pretty much connected, except for some issues in China. When it comes to India, we've done phase 1. We've done over 35 unannounced or announced within 24 hours inspections. We're now into phase 2, which is the regular inspection. And then we're going to do a comparison to find out what was learned. For China, we've been blocked until just the end of January, as you know, when the order was lifted to allow people into China. And so beginning about May, we're going to be doing the unannounced and other inspections in China also in full force as much as we can.
I was going to say, do you know if anyone's had their visas not approved? Are you facing any headwinds there when it comes to denials of entry?
Let me just say that in my tour of jobs, I helped start a university in China and also did a lot of work in clinical trials in China. And I'm very familiar with the issues there. We're worried about what I think you're alluding to. To this date, no one's visa has been blocked, but it's not easy to navigate. Often language is a problem. You need a translator who you can trust. As part of that, it has to be lined up to make sure you're in the right place at the right time. So a lot of logistics here that are tough, but we're going to do it.
Yeah, and I would say please keep us in the loop if you are facing any of those challenges in dealing with the Chinese Communist Party, because I think the last thing we need to see is that stonewalling happening when so much of our pharmaceutical industry is relying upon precursors or manufacturing in China. The last thing we need, again, is that blocking to address issues there. What are some of your biggest concerns in that space? I mean, what do you anticipate finding? What are some of the red flags that you are kind of looking out for in terms of safety process? Can you just elaborate on that a little bit?
Well, first of all, let me just say the supply chain issues, and as I said, in every commodity we regulate except tobacco are profound. And this goes for drugs, devices, biologics. The offshoring of American industry, I think, is a big problem. I'd also say, if you look at the infant formula problem, onshoring itself is not a total solution to the problem either. What we need is a supply chain system with resilience built into it around the world and not overly dependent on one area. And the reliance on China in particular to such a large extent is a problem because it's opaque. And even if we do periodic inspections, it's not the same as a society where you have more freedom of information that's flowing. So I'm very concerned about it. I'm not arguing that onshoring everything is a solution, but I think we've really got to pay more attention to this.
Well, certainly we cannot trust the Chinese Communist Party. If we've learned anything, we have spent decades appeasing them instead of competing with them, and we hope they'll take us seriously. Are you tracking in the few moments that I have left any other challenges with the Chinese Communist Party that this committee should be aware of?
I mean, I think everyone's aware of the just issues that come from lack of access to information that's coming from China. And as one who, there's a word co-opetition, as one who in the past has worked in China, You know, it's 1.6 billion people. Whether we like it or not, they're inventing and developing a lot of things on their own. So across the board of everything we do, I would love it if we had better communications, but we also have to be independent. We can't allow ourselves to be dependent on China. And that goes for all the commodities that we regulate, including food.
Thank you, Mr. Commissioner. I yield back.
Thank you. Ms. DeLauro.